Okay. I'm starting now.
Perfect. Yeah, you'll go. Great. Thank you.
Yeah. This is the presentation about the home-based early intervention program that we started with GCC and supported by Saving Brains way back in 2014, when the idea came up that children with developmental delays in these areas are not given enough or adequate opportunities to access these early intervention services. There are many reasons for not being able to access them. Most important things were the non-availability of rehabilitation professionals and specialists who could diagnose them and prescribe therapies for them. And most of the approach towards children with developmental delays were medical in nature, and there were centers established by the government at the district headquarters, which are far away. And these headquarters had a lot of specialists and professionals, but they could handle only a few people. So the reach of the early intervention services for these children were not there. It is not accessible for the people. And another important feature is that the mothers and caregivers were not able to get enough guidance to follow up the treatment plan or whatever that is being prescribed by the specialist at the district headquarters. And they lose a lot of time. They spend a lot of energy and resources for going to the headquarters and so on. So our model was to try to get the services in their homes and at the same time keep the project under total monitoring so that the delivery is ensured and the quality is also maintained. So our others are the parents become the therapy providers, and our team of people would be the supporting people who would train them and educate them how to manage their children and provide therapies. So we developed teams at the geographically assigned areas, preferably to a population of 100 families with disabilities, where there will be a community rehab worker assigned with 20 children each, and there will be specialists in the form of physiotherapists, special educators, then speech trainers and occupational therapists. So they go on a weekly basis to provide support and supervise the training, and monthly follow-up by the specialists also will be there. So the entire program is monitored by the GPS-enabled technology, which tracks the workers' movement, and also they log in and log out every time they do the therapy, so that the entire case history is digitally maintained, and it is system generated whenever the report is required. Awareness and educational programs were also given a lot of importance because that gives them a feel of why they are doing it and how the inputs or the therapies will provide improvements for their children. So the entire process will be like a complete end-to-end cycle, right from screening done by our rehab workers to generating the baseline data. A special assessment will be done based on the conditions of the child. The entire thing will be in the mobile app. Then with the parents, with the families, goals will be set and the treatment plans will be made for each child, and the therapy schedule will be followed up. In the entire program being monitored and managed digitally. The 6 monthly evaluation is also a part of the scheduling. So the improvement of the child is also captured every 6 months. In Tamil Nadu, there is a huge population of more than 100,000 children under the age 6. So here we plan to take about 67% of them who are in the rural areas. So to begin with, we did in 8 blocks, and we covered about 1,252 children, and the results are extremely good. There is a very good engagement because the whole program is monitored through the mobile app. So the compliance to the therapy schedules are very good. It is 87%, and the improvement in the caregiver to child interaction is also very high. And the family in the process are being improved in terms of their empowerment and also decrease in terms of their caregiver strain. So we have several scales for all this. There are internationally accepted scales to track these changes. We have our own scale for measuring the caregiver strain developed by our team, and the entire improvement has resulted in a good, very healthy school enrollment of 85% now from being 70% before. So with the success, we have now visioned about scaling up this program. We are planning to reach about 89,000 children by 2025 March. At present, during the current year, we are planning to reach about 4,200 children by 2021 September. We are scaling up with the government of Tamil Nadu. We have few other NGO partners who are lined up. One or two in global places also, like Ethiopia and also to Cambodia, near to our Vietnamese friends. And this entire process, we hope to cover during the next 5 years. By 2025, we would have reached about 3 countries at least, 4 countries. There will be 4 NGOs which will be working, both the Tamil Nadu state government and the central government also will be fully involved. And we plan to cover the entire state of Tamil Nadu, rural areas, by 2025. Now coming to the challenges, the main challenge is now the COVID condition. Now there is a new normal, and there are a lot of restrictions in reaching out to the children and in reaching out to the door-to-door services. A lot of challenges in providing awareness programs through various means. So these restrictions are some of the great challenges that we are currently facing. There is also a shortage in the professionals, the rehab professionals, not only in India, but also we foresee these challenges in other low-income countries. So this is going to be another area which is going to be a big challenge for us to address. Then continuing the current 8 blocks that we are now working with GCC through the Saving Brain support, is that to get the government into the entire program so that they slowly take over. The second alternative of continuing this is to slowly hand over to the people themselves. For that, the people needs resources. So how we are going to manage that is also another challenge. Another challenge is while we are going to scale up, there are NGOs who are interested in taking up. But then they are in need of funds, they are in need of support. So how the revenue model can be worked out. So even though the cost of the child per month or per year is pretty low, still it is a challenge by itself. And not many could afford, except for some people who are quite well off. But in rural areas, not many are resourceful to pay for these services. Then coming to the medium to long term, the recruitment of talent is going to pose a challenge because when you scale up, when you are going to have an establishment for scaling up, you need separate set of skills and abilities. You transform from being a program implementer to a program facilitator. So you become a person, an entity who is going to transfer knowledge, provide handholding support, also maintain the quality and the fidelity of the programs managed by these NGOs. So for this, you need to have good talented people to manage them. So this is going to be a challenge in the medium term. Then the app has to be upgraded to meet to many contexts. What that is helping us here in India, in Tamil Nadu, may not be good enough for a country like Ethiopia. There you need a more parent-facing approach, parent-facing technology that would support them. Here what we have is a technology, is an app that provides a lot of technological and technical inputs for the specialists and the rehab workers. But when you are dealing with low resource countries, the app has to be more global in approach and addressing to all scenarios. Another important challenge is that we need to look at the tele-rehab. We have already started this in a small way, and it is showing a good promise. But how we are going to develop it into a good, cost-effective, at the same time, a quality solution. When you are going to reach people through these remote means to engage the parents for the rehabilitation of their children, how we are going to set up this tele-rehab technology and achieve a same level of quality and outcomes. That's going to be a challenge by itself. Then coming to the various stakeholders' engagements, we have the child, we have the caregivers, we have the community rehab workers called CRWs, the rehab specialists. There are various ways by which the program provides value creation for these stakeholders and what these stakeholders can give to the program by itself. For example, a child gets early intervention therapy, but as a child, it gives back a capable child by itself, which is contributing to the overall well-being of the society. A healthy child is the return that the child is giving to the society. Similarly, a rehab specialist, for example, provides therapy, but a rehab specialist, she gets an opportunity to train other workers and also get herself also developed and build her own capacities. Similarly, there are schools, there are business, and there are funders. Each one, there is a value created for them and what, as a stakeholder, they contribute to the program. For example, a school, you get more children, the school gets more children enrollment, but the school gives back by creating an inclusive atmosphere. For a business, for example, it is an opportunity for CSR compliances. They can have a good project for supporting a CSR program. And as a business, they contribute to a social cause. Similar, the same with funders. Then you have society. There is a reduction in poverty in the society, less burden on the breadwinners, and the people who are thought to be burdened, the disabled people as such, became breadwinners. That's a big change. And what they provide is opportunity for job, opportunity for access, and same with NGOs. Similarly, in an economy, you have children who become contributors. As an economy, they get good people who become potential consumers, which improves the GDP of the country as a whole. Then you have government, similarly a reduction in poverty, and on return, they give out a cost-effective scheme. And again, a higher investment in quality life resulting in returning back a beneficial scheme at family level. Then you have the politicians who have a very good chance of coming out with a program that will benefit the people, which will provide a vote, a good electorate for them, and they in turn provide policy changes. Coming to the resource strengths and opportunities and ideas, we have very good application that is time tested, excellent training materials for various levels. Then we have a very good standard operating procedure in place where we can transfer our knowledge into a program to various NGOs. We have a licensing model, which is a payment model. Then we have a research and study outcomes, which are very good for knowledge development and further, study into the area. Then we have very good resource in the international conference that we conducted earlier this year. Our strength is good rapport with the government, and our organization is having very good reputation in the public. The opportunities are a lot of the opportunities for funding, and there are also government which are interested in taking up this project. Our ideas are like to develop the rehab program so that it becomes less costly, more beneficial to the people, and maintaining the same quality. This is a very good potential, which we have a lot of ideas. Then the mother-facing app. This is a parent-facing app. Right now, our app is more like a solution for the rehab worker and the physiotherapist and the special educator and other specialists in the area. But now we are developing with other NGO partners, co-creating them into a more user-friendly app, which has two interfaces, one for the specialist and another one is for the caregivers. Then the priority areas for discussion, how to get funding for NGOs. This is something which I already touched upon during the presentation. How to get the partnership going forward, because NGOs depend on funding. How to identify a like-minded NGO which shares our values and principles. There are government and NGOs, but we don't want to dilute the quality and the fidelity of the program. How to ensure that whom we are working is like what we want, the same kind of principles and values, whether they share, how much they align with us. Then when we scale up, we should ensure quality and it should not be diluted. So there has to be a balance between quality and reach, how we are going to manage that. Then from all above, we need to learn from other members in the team also. What is their experience in scaling up, how they are successful. Those sharing will also help us mutually in exchanging our ideas in going forward with this scale-up program. So that's it. That's where we are. That's where we are now. I am now finished. Yeah.
Thank you so much, Sankara. You did that in 19 minutes as well. You got a special prize for actually finishing 1 minute under the time. So thank you so much, because that was also extremely clear and
okay.
great explanation.